Hi, I'm Dr. Naveen Chandra G S. I'm a lead consultant in the Department of Cardiology in Aster Hospital, Whitefield. On the eve of the World Heart Day, which is on 29th of September, let's discuss about cardiovascular health and exercise. As we all know, exercise is one of the very important ways to prevent cardiovascular diseases, and also in patients with heart diseases also we do prescribe exercise. There are a lot of myths and doubts around how much to exercise, what is a safe limit, and there are certain myths about exercises and onset of heart attacks and heart disease itself. Let's discuss one by one. For a cardiovascular health and cardiovascular benefit, what we advocate is a moderate intensity of exercise. Now, what do you mean by moderate intensity of exercise? There is something called a target heart rate, which we don't push more than 80% of the target heart rate. In simple words, if at all you are doing an exercise with your fellow, you will be able to have a meaningful conversations or at least half a sentence with him. That is called moderate intensity exercise. Now, what are moderate intensity exercises? A simple walk, a brisk walk, what you call, a doubles tennis, or cycling at a speed of around 10 to 20 kilometers per hour. These are some of the moderate intensity exercise. For a cardiovascular benefit, a moderate intensity exercise of 30 minutes per day, at least 150 minutes a week is more than sufficient. This gives you the best cardiovascular benefit. You can also combine a little bit of strength training, balance training, especially people who are more than 60 years of old. We at least ask them to do 2 days a week of strength training and balance exercises as well. For additional benefit, we can also do a lot of muscle strengthening and strengthening exercise at least 2 to 3 days a week as well. But bare minimum is a moderate intensity exercise of minimum 30 minutes per day or 150 minutes per week. Now, what's the myth about exercise and heart attacks or heart diseases? There are certain things I want to clarify. A moderate intensity exercise can be easily done by anyone. It doesn't increase any risk of any heart cardiovascular diseases. Let's say you are walking, brisk walking, it really doesn't increase the risk of developing heart disease. If you see statistics, a person who is more sedentary is likely to develop a heart attack, which is 50 times as much as a higher risk than a person who regularly exercises. So the likelihood of having a heart attack in a sedentary person is much higher than a person who does exercise. When it comes to high intensity exercise, this confusion comes. Even high intensity exercises, when it is done much more structured, when you escalate your exercise in a much more structured way, the likelihood of developing any heart disease or heart attacks are very less. How does exercise improve your cardiovascular health? Now, it helps by 2 to 3 things. One, it helps in reducing your risk factors itself. Now, it reduces hypertension, it reduces the sugar level, it improves your cholesterol, it improves a lot more things which can lead to heart attacks. And also it improves your cardiovascular health per se. And psychological benefits of exercise is what is always underrated. The stress, the depression, and the anxiety levels in a person who regularly exercises much lesser than a person who has a much more sedentary lifestyle. Looking at all this data, it's always important to have at least a moderate intensity exercise to prevent heart disease. On the eve of World Heart Day, let's get up and start exercising.